Hi, my name is Benoy Mathews, specialist physiotherapist and expert shockwave trainer. In this video, I'll be talking 5 reasons why you should choose Focused Shockwave. So, shockwave is a well-proven modality for chronic musculoskeletal condition, especially heel pain and tendinopathy. Most therapists are aware of Radial Shockwave. Excellent device, works really well for heel pain and also for chronic tendinopathy. However, it's got its limitations. So there are a few reasons, my top 5 reasons why I would choose Focus. So with the Focus, it's as you can say, pick from the name, it's more energy, more focus. My number 1 reason is it's less painful. So a lot of patients are not able to tolerate radial because of painful, it's too painful for them. An example would be tennis elbow. It's bang on the bone, extremely painful, especially in the irritable stage, or insertional Achilles. Can be very painful with radial. So we get a lot of patients who can't tolerate radial. In this case, Focus would be an extremely useful option because you get this sort of similar or if not more energy but with less pain. So if you failed shockwave because or you can't tolerate it, then Focus might be a good option. The second reason is bone stress injuries. So radial doesn't have any role in bone injuries, stress injuries. So I'm actually treating a runner with a medial kibble stress syndrome later today. So conditions like medial kibble stress syndrome, osteitis pubis, and even conditions like non-union. I'm seeing a non-union of a tibia next week. So where conditions where radial doesn't have any role, it responds really well with Focus. How does it work? It stimulates bone healing, and it's a fantastic tool for bone remodeling. So if you have chronic bone stress injuries, struggling with your shin splints, struggling with your athletic pubalgia linked with osteitis pubis, then Focus might be a good option, especially you see that in rotational sports. So bone stress injury, again a key indication for Focus. The third key thing is, not many people are aware is Focus is an excellent modality for chronic arthritis, especially of your knee and big toe. So we know that it works on the subchondral bone, and that can really stimulate the key process which is involved in pain relief. So if you're suffering from mild to moderate knee OA, that might be a good option if you want to avoid more expensive treatments or invasive options and you've failed a period of rehab. Then a course of 5 to 6 sessions with Focus along with the tailor-made program can make a big relief for arthritic conditions. So main ones we treat from a joint point of view is knee OA and big toe. Fourth is the depth. So when you're dealing with a normal device like a radial, you're talking about a depth of about 3 to 4 centimeters. If you get somebody coming with a lateral hip pain and the depth can be 5 to 6 centimeters, you won't be able to go. So with the advantage of Focus, you got 3 different transmitters. So this you're talking about, I can go around 3 to 4. This is sort of, I could go for anywhere from 5 to 6 or 5 to 7. And if I take this off totally, I could go all the way to 8 to 12 centimeters. So I can tailor it exactly the depth I want. So if you're dealing with deeper structures, somebody is a little bit obese or muscular, like a proximal hamstrings or lateral hip, and you're not getting the same benefits with your radial, it could be because the energy is not getting there. So we might be using Focus. So any conditions which leads to depth, then Focus might be a key option. The last option is it opens up a lot of conditions which you can't really treat with your radial. For example, Morton's neuroma. So that's an excellent condition which responds well with Focus. Lumbar facet joint pain because of the depth. So again, we got 2 RCTs which showed like it's quite useful in facet joint pain. Wound healing. So we treat a lot of diabetic wound. So we put a bit of a sterile, gauze over there, and just we work around that region. So excellent for wound healing. Chronic pelvic pain. Erectile dysfunction. So a lot of non-MSK indications as well. So you're opening up a different set of indications. So those are the key reasons. So if you're having condition where you can't treat radial, or if it's too deeper, dealing with bone stress injuries, or knee arthritis, then a good evidence-based option is Focused Shockwave. So those are my top 5 reasons why you should choose Focus rather than radial.